Today we're going to be discussing VQ scans in nuclear medicine. VQ scan stands for ventilation over perfusion. They're one of the common scans utilized in nuclear medicine. They use radiopharmaceuticals in order to evaluate lung perfusion and ventilation, and they're commonly used to diagnose pulmonary embolism. So there's two different aspects of the scans. For the perfusion aspect, a variant of technetium called microaggregated albumin is used. This is injected intravenously and it travels to the lung parenchyma. It follows the blood flow through the lung parenchyma, allowing us to detect any perfusion defects. For the ventilation aspect, there's two things that can be commonly utilized. Xenon gas is used by inhalation, or another variant of technetium, DTPA, can also be used by inhalation. VQ scans are commonly utilized in patients who have contraindications to CTPA. For example, if they're pregnant, renal insufficiency, or severe contrast allergies. Once the images are captured and processed and areas of defects or mismatch are identified, radiologists can use various criteria in order to say if the patient has a PE or a high likelihood of a PE, or if they don't think the patient has a PE or has a low likelihood of having a PE. So again, these are just examples of major criteria used, and these are all based on extensive studies conducted. For example, this criteria, we can see that if there's more than two large mismatched VQ segmental defects, then that means the patient has a high likelihood of having a PE. And for example, this one on the other hand is a perfusion-only criteria. So in this case, if there's more than one wedge-shaped defect, then the patient is likely to have a pulmonary embolism. Again, they can also have non-diagnostic results, although non-diagnostic results are not generally helpful clinically, so radiologists try to say if there's a PE or if there isn't in most cases. What we're looking for on a VQ scan is to identify areas where there's a perfusion defect, although the ventilation might be normal, and this is considered a mismatch. PE tends to be generally less likely in cases of a match defect, and as we saw in the last slide, there's various criteria which you can use to help classify a PE or not based on the segments of mismatch or perfusion ventilation defects. So this is an example of a normal perfusion scan. We can notice how all the areas in the lungs, all the lobes of the lungs are perfused well throughout. The apices are well perfused, and we don't see any wedge segments or decreased areas of perfusion anywhere. So this is what a normal perfusion should look like. This is another example, and again, we start off by trying to identify perfusion and then looking at the ventilation and to see if the areas match up. So on this side is the perfusion at different angles of the lungs, and over here is the ventilation. And this right here is just the perfusion from right posterior oblique side, so it's the same image. And again, we start off from here, and we notice how there are a little bit of segmental defects in the bottom right here, and a little bit over here in the top. And we notice how the ventilation, it appears to be completely fine. We can see how there's adequate ventilation throughout the lungs. There's no areas of segmental defect. So this would be classified as a PE because we do have a mismatch. There's a mismatch in the perfusion down here, while the ventilation appears to be completely fine down here and up here as well. So this is a multi-segmental pulmonary embolism. This is another example, and we start off by looking at the perfusion and then comparing it to the ventilation. So the patient received technetium macroaggregated albumin, and this is the left posterior oblique view, and this is the right posterior oblique view of the perfusion. And then we're trying to make sure that we're anatomically thorough and look at all the lobes of the lungs and the apices. So we start off by identifying if there are any areas of perfusion defects, a little bit of dark area up here. And then we can look at the ventilation side and we notice how there's adequate ventilation up here, although the perfusion seems to be quite poor in the apices of the lung. It seems to be fine throughout in the bottom aspect. We can notice that over here, and it's comparable on the left lobe of the lung, although on the right apices we notice how there's decreased perfusion compared to the ventilation. And then we look at this scan and notice something similar, and the apices right here, a little bit of dark area compared to the ventilation, which is adequate in here. So this would be classified as a PE. So again, whenever you're looking at these scans, it's important to identify the perfusion first and then compare it to the ventilation and to identify any areas of mismatch. And as we discussed earlier, there's various criteria which can be used to classify a PE or not. So thank you guys for watching, and I hope this was helpful.